For those of us that typically do join us for these presentations, thank you again for joining us. But tonight's webinar or conference call, whatever you prefer to call it, it's a little bit different. Normally, the last few months we've been bringing on mostly medical experts, and we do have Dr. Kopko, who is definitely a medical expert, on with us. But the main speaker tonight is really just, I would say, sort of an average ordinary person. But when you hear her story, you may not think she's an average ordinary person, because I don't think she's an average ordinary person. But she's not a medical expert. I asked her to be willing to share her story with us because I found it very fascinating. And for those of us that are familiar with the disease lupus, you may find this story fascinating and interesting as well. And I was particularly drawn to her story, not only because we became friends as we talked over work here with Life Ionizers, but also because I have a very close relative who shares this same ailment, and it's a very difficult disease to find good methods to help it. And I'm very excited that my friend Nelda Leppeholtz, who's joined us tonight out in Texas, is willing to share a little bit of her story, because I think a lot of us know people that have this ailment, and there's not a lot of people that are having good success with finding ways to combat this ailment. So Nelda, good evening. Thanks for joining us. How are you doing tonight?
Thank you. I'm doing very well. Thank you.
All right. Well, I appreciate you joining us. We also have Dr. Kopko, who's going to be joining us after Nelda gets done speaking in a few minutes. And I thank you, Dr. Kopko, for setting aside some time to join us as well, who's our Chief Science Advisor. But Nelda, I'll go ahead and turn the table over to you and ask you, if you don't mind, to share a little bit of some of the trials and tribulations that you've gone through, and what items you've had to try to overcome, and where you are today on it.
Okay. In 1988, I was diagnosed with lupus. At the time, I'd never even heard of it. Later in the day, when my sister heard my report, she was quite concerned and explained the seriousness of the disease, and even worse, the damage it can do to any organ in the body. She also commented that we had a first cousin who had recently died of it. This really got my attention. In the following weeks, the doctors made inquiries into my past records and found that the lupus had showed up on my test as long as 8 years before. So this had been working on my body for quite some time without anyone picking up on the symptoms. Very little was known about lupus at that time, and treatments for it were rather uncertain. They decided on steroid injections 2 months apart for me. In 3 months, my weight gain was 40 pounds, and I was feeling worse every day. So I decided no more shots for me. There had to be a better way. After doing extensive research on my own, I began an herbal regimen, which helped me show an improvement in about a month. And in 2 years, I began to get negative tests. Since then, as long as I stay on the herbal combination, my tests continue to be negative. However, the initial bout with lupus left me with severe damage to my lungs, my kidneys, joints, and weakened my immune system. During the next few years, I began having asthma attacks and serious allergies. It was necessary for me to be on oxygen all night and several hours during the day, just trying to deal with the constant pain without taking the debilitating drugs that were offered was unnerving at the very least.
I bet.
In 2001, I had a stroke, but I wasn't aware that that's what was going on, mostly because I had had so much pain over the years, and I really just thought this was just something else that was happening, and I delayed going to the doctor for a day or so, and finally realized my thinking was impaired, and so finally went to the doctor. He informed me I'd had a stroke and should be admitted to the hospital. An MRI and other tests were done, which showed bleeding was still occurring. So an operation to the occipital area of my head was done to stop the problem. The recovery from that was slow, and 6 months later, an MRI showed there was still bleeding again, and they had to go back in and perform another surgery in the same place. This time, my recovery went much better. Fortunately, even with the complications, since I had such an able surgeon, there was no permanent damage from the stroke or the surgery procedures, for which I am most grateful. Over the years, all the illness really took its toll on me, and by 2009, my strength was depleted to the point I could hardly go out of the house, and never alone. I didn't feel safe driving anymore because of the dizzy spells and weakness. I had constant pain in all my joints and had to use a walker to get around even in the house. I wasn't able to go to Oklahoma to attend my son's funeral because I couldn't ride that far. This was one of the hardest things I have ever had to accept. Then a friend of ours suggested to my husband that I try the Life Ionized water and brought me a gallon of it with instructions of drinking it. That was the beginning of my renewed life. After drinking the water for 2 weeks, the difference was noticeable. After 2 months, I felt strength and energy like I hadn't felt in years. Now, people who had come to my house to see me before, because I couldn't go out anywhere, and they would come to my home to see me, and then now they see me out somewhere and they say, "What has happened to you? You look so vibrant, just like you used to." And that's just the way I feel now. So much energy, able to do things I haven't been able to do in years. I will have my 80th birthday next month.
Congratulations.
And, there are so many things I still have to do. I must get busy so I can get them all done. Some people might think I'm just a crazy little old lady, but if they had been where I have been in the last few years and where I am now and the way I feel now, they would say, that old gal just might have something there. And believe me, I do. It's a miracle called Life Ionized water. I drink it every day. I would advise everyone to do so. It will make a difference in your life.
That's a great story, and I'm so happy for you that you're in much better health than you were before after not getting a lot of help trying to identify the original problem. What kind of differences have you noticed, Nelda, on pain levels as far as with your what we talked about with all the pain you were having in your joints and stuff? Have you noticed a difference in that the last few years, or not much?
Pain.
That's hard for you.
Today, I have no pain. And I drink a lot of the alkaline water every day. And at one time, before I got my machine, I was depending on someone to bring it to me, and I was without it for about 2 weeks, and I started having the pain again. And so believe me, that is making the difference. And I got the machine. I won't do without it again.
Appreciate you sharing that. I know you also told me the other day that one of your family members, I think it was your sister, has started drinking this recently. How does she like alkaline water so far, Nelda?
Well, she has had problems with arthritis, and it has made a big difference in her. And she's also made the statement she won't go without it again. She comes to get water from me every other day, and she drinks it all the time now. And she's 86, and she's able to do so many things. She takes care of grandchildren, great-grandchildren, and so on, and she's very active. But this arthritis had begun to really slow her down a lot, and now she's not hurting like she was, and her knee was especially bothering her, and that's cleared up.
Gotcha.
And her energy has increased. She's also mentioned that.
Great to hear. Appreciate you being willing to join us tonight to share your story. I have a lot of folks that I run into that ask me if we ever hear anybody who has had lupus and had any type of success doing anything. We've asked Dr. Kopko to join us. Folks, let me introduce Dr. Kopko, who's on the other line as well. Dr. Kopko is our Chief Science Advisor. Dr. Kopko is a certified doctor of chiropractic who's got a subspecialty in sports medicine. He's a nutritionist. He's a dark field microscopist, and he's got a lot of research in a lot of different areas on a lot of different subjects. And I asked Dr. Kopko, who doesn't have anything to do with the treatment of Nelda and is not here to testify anything on Nelda's story, just to talk to us a little bit about things that you can share with us about what you know on lupus and what you see out there for traditional treatments, because we get an awful lot of questions about what do we know about lupus, and I appreciate both of you guys joining us. So, Dr. Kopko, I'll turn the floor over to you for a minute.
All right, thank you, Jeff, and hello to everyone. Lupus is a very difficult condition sometimes to even diagnose, let alone treat. Let me start a little bit with just some basic information about lupus so that everyone understands, because probably know someone who may have it, because oftentimes there are so many different symptoms associated with this condition. People are often called a hypochondriac because they have so many different complaints, and until they're all kind of put in this basket that's called lupus, they're just kind of left hanging. Lupus is an autoimmune connective tissue disease, and what that means is that it's a systemic problem, because connective tissue is throughout your entire body: your heart, your joints, your skin, your lungs, your blood vessels, liver, kidneys, nervous system. And your immune system is now attacking this tissue. So it's primarily a problem with your immune system, but it's attacking the body cells and tissue. And the key is that it results in inflammation of all these different tissues. And in my opinion, this is where alkaline ionized microclustered water is helpful, because this water helps with inflammation. Now, I often explain to my patients that any condition that you manifest, I have an analogy of how certain conditions are set off in the body. Now, technically, there are things called oncogenes, which when set off, a certain disease or condition will manifest. And my analogy is you've got this big black pot with all of your genetic predispositions sitting in this pot of water, and it's the flame of inflammation, that boils this pot. And when the pot boils over, you manifest conditions. And if the condition itself, like lupus, results in inflammation, it can set off this chain reaction throughout the entire body. A question I'm also asked often is, what does the word lupus, where does that word come from? And it actually comes from Latin for wolf. And there are two theories about how this condition was named. One is that the characteristic lupus facial rash, which is called a butterfly rash. Looks like a person who has been either bit in the face by a wolf, or others say that the rash resembles the pattern or color on a wolf's face. But that's where the word lupus goes into systemic lupus erythematosus, or SLE. Some of the symptoms, which can be many, once again it gets back to the idea of being a hypochondriac until it's all put together, because SLE is also known as the great imitator. But the symptoms can range from fever to malaise, joint pains, myalgias, chronic fatigue, rashes on the skin. There are many, many different symptoms associated with this condition. And once again, these are all manifesting inflammation in the body. And once again, it's my opinion that when you introduce water, good alkaline microclustered ionized water, which acts as an antioxidant, my analogy there is that this water is literally putting the flame out that's underneath this pot that's boiling over with all these genetic predispositions. Water also helps your entire body maintain its natural pH. And a lot of people think, well, your body's always going to regulate your pH. But as we age, the pH regulating capability of our kidneys tends to decrease. So it becomes tougher as we age to maintain that proper pH. And when your pH is off, none of your enzymes work properly in your body. It doesn't have to be off much. If your temperature is supposed to be 98.6, and if it's 99 or 100 or 97, you're not going to work, your system physiologically is not going to work at its optimal level. It doesn't have to be off much. The medical community at this time thinks that your body will always, under all circumstances, balance itself out. And it doesn't under all circumstances, because sometimes it malfunctions. And it's been documented many times in the literature that the classic Western diet creates what's known as a chronic metabolic acidosis. And the quickest way I know to correct that is through drinking this water. Do we have any questions, Jeff?
Thank you for that information. Folks, once again, for those of us that have joined us, if you'd like to ask a question, I don't have the phone line set up where you can speak on the phone to keep the sound quality. It's tough to have multiple speakers and phone lines open, but you have a toolbar that when you signed in tonight, if you click on that toolbar, it'll open up, and when it's expanded, at the bottom of that GoToMeeting toolbar, there's a text box. You can literally type in your question at this time, and I'll give us a minute or two to type in if anybody has any questions. And while we're waiting for questions to come over on the screen for me to see them and read them out loud, I will just say I thank you both, Nelda and Dr. Kopko, for joining us. Our intent tonight is to educate and inform. None of the three of us are here to try to make guarantees to anybody, but I'll tell you from mine and Nelda's standpoint, and I know I'm speaking for Nelda on this because she's mentioned this several times, our feeling was if this information tonight helped one person, it would make us feel darn happy that one person got better educated about a particular ailment and maybe found one route that might help alleviate at least some of the pain. And that's what we're here to try to do, folks. So dealers and guests that have joined us tonight, I thank you for joining us. Again, if you have any questions you'd like to type in, you'll want to go ahead and type them in your text box at the bottom. And while I've got you on the phone, folks, for you dealers that are on the phone, and I see we have a pretty large crowd signed in tonight. I can't tell off the top of my head how many dealers and how many guests that we have total, but I know we have some dealers that I recognize in our registration sign-up tonight. Dealers, we're having a dealer webinar this coming Tuesday on a different subject. And I encourage you, if you happen to have the ability to join a webinar that are dealers on the phone this coming Tuesday at 5 p.m. Pacific time, please look for that email invite that just went out tonight. Okay, our first, yes, sir.
There were a few things I wanted to add maybe before, unless you've got some specific questions there.
I have, we can do this any way you want, Dr. Kopko. I have 2 questions that just came through, or if you'd rather bring up your points now or after, whatever you prefer.
All right, I'll bring them up now. It's not very long. I just wanted to say that oftentimes rheumatoid arthritis and MS are misdiagnosed when the person actually has lupus until the other symptoms tend to manifest. They're given a preliminary diagnosis of rheumatoid arthritis and or MS. Another interesting thing is that there is no known cause or cure for this condition, but interestingly enough, there have been some studies done because women are approximately 9 times more affected by this condition by men, and if they're still in a childbearing age, it's 10 times because there appears to be a hormonal component to this condition along with genetic environmental factors. And along those lines, an interesting discovery was made that wearing lipstick, there's something in commercial lipstick, they don't know what it is, but they did a study of several hundred women, and there was a significant increase among women who wore lipstick 3 or more times a week in actually getting this condition. So if you're going to wear lipstick, my advice to you is to wear organic lipstick.
Interesting theories. I'd never heard that of. That's great information. I appreciate that. All right, folks, I've got 3 questions. Nelda, are you still with me?
Yes, I'm still
here.
Right, I'm so interested in what I'm hearing.
Yeah, me too. Dr. Kopko is a wealth of information. I love any time I get a chance to hear him speak. This first question, Nelda, is definitely for you. The question is, what was the time period in which you began to notice a benefit from the ionized water, and how long did it take to get full benefits, or the full benefits that you got from the water, would you say, Nelda?
I would say I began to really get a full benefit in 2 months. And then it has only been about 6 months that I have been on it, you know, getting really full benefits from it. And that is, I'm not sure exactly how long it has been, but that's about the length of time. And gotcha. I was going to say, it was 1 year ago that my son died. And so I was so bad off then that I couldn't even get out of the house. And so 1 year ago, I didn't think I'd be alive today. I was so sick.
Appreciate your comments, and I can relate to it. My mother-in-law has lupus, and she is in tremendous pain, and it just has been very difficult to find any treatment other than just heavy pain medication that seems to give her any relief. So appreciate the insights on this. The next question I've got, folks, changing gears, is I'm going to throw this at you, Dr. Kopko, on the first part if you're interested, and if not, I'll take it. It's a 2-part question. I'll take the second part if you take the first part. The first part is, what pH level is the body supposed to be at, and what pH is this water actually at? I'll take this latter if you take the first part of the question.
Well, blood pH is approximately 7.356, which makes it alkaline. What was that the first part of the question?
The first part of the question was just, what pH level would you say the body's supposed to be at? What would be an ideal pH level to strive for, or to try to push towards?
Well, when you talk about the body, you've got to talk about various parts of the body. You've got You've got what should be the pH of your saliva, what should be the pH of your blood, what should be the pH of your urine, etc. Oftentimes articles are written and they don't really talk about, when they say the pH of the body is, you need to define what part of the body you're talking about. Now, in my opinion and from my research and from my clinical experience, if you want to use pH test strips, your saliva should be alkaline. Your blood is most definitely alkaline. And your urine should be neutral or alkaline. Most people have exceptionally acidic urine.
Right.
And once again, in the medical community, they say that's your body getting rid of it. Well, in a sense it is, but at a price. This is burning your kidneys, burning your bladder. It's robbing your bones of calcium to buffer this acidity, and this is how we end up with osteoporosis and kidney stones. I'll let you take the latter part.
Right. Thank you. And along the same lines, you know, I think, and Dr. Kopko can add to this if he wishes, but, you know, one of the main benefits of alkaline water is you're putting an increased pH level water in your body, which is giving your body a chance to become more alkaline. So that, I think, is really the biggest driver. The latter question was, what pH level is this water? Well, to put it in perspective, you know, most people's communities' tap waters, the pH level of tap water is somewhere to the low to maybe a mid-7, depending on your community. That's a pretty neutral pH level. To get more of an alkaline pH level, you definitely would like to get at a higher pH level. And the answer to the question is, it really depends on what's in your local water supply and what affects the water in your own household. But we've seen people with these machines that can derive 11 and 12-point pH level readings. I've also seen some people's households that can't seem to get a pH level over, say, a high 9 or a mid 9 or a 10. So it does depend on what is involved in your local water supply and what contaminants are already in there and what has to be removed and what you have to use to remove those. But I will say, without a doubt, for everybody and anybody, alkaline water is going to provide you with a great resource to drink a water that's at a significantly higher pH level than any tap water or any bottled water that we've ever tested here, that I've ever ran a test on or seen a test on. So thank you for the comments on that. The next question we have, I'm going to ask Dr. Kopko if you have any insights on this. Okay, if you don't. The question is, I had a tremor in my hands and mouth. Have you ever seen anybody experience any benefits from alkaline water with those type of tremors, Doc?
Well, as I tell my patients and the general public when I get questions like this, as to what caused that individual's particular problems, we don't know. But any time that you ingest alkaline, ionized, microclustered water, you're going to help your system deal and heal. And I mean, that's as much as you can ask for any particular healing program, as opposed to taking symptom-suppressing what we call allopathic drugs.
Gotcha. Good insights. Yeah, that's always a tough one to answer on the spot. Appreciate the insight on that. Folks, at this time, we've promised to close out tonight's webinar. I'm seeing a few more questions. Looks like they're trying to come through. I'm going to leave you my contact information on the PowerPoint that you have. My name is Jeff Blair. I'm the Dealer Support Manager. I thank you, everybody, dealers and guests that have joined us tonight. If you didn't get your question answered or trying to type it in still at this point, go ahead and email me the question. I'll be glad to get anybody else answers if your question didn't get addressed tonight. Nelda, thank you for joining us. Dr. Kopko, thank you for joining us. And everybody, have a safe evening. And thank you all very much. Take care.
Good night.
Good night.
Thank you. Jeff, are you there?